Oxygen uptake and lung capacity. The most significant improvements in response to aerobic training are in oxygen uptake, or VO2. The body consumes only small amounts of oxygen at rest. However, as we begin to exercise, the mighty mitochondria in the cells use more oxygen in the provision of energy. Maximum oxygen uptake, or VO2 max, is regarded as the best indicator of cardiorespiratory endurance because it indicates the maximum amount of oxygen that muscles can absorb and use at that level of work. Maximum oxygen uptake is relatively easy to estimate using tests such as the bicycle ergometer in a lab or field tests such as a 12-minute run or beep test. A high VO2 max indicates a superior oxygen delivery system and contributes to outstanding endurance performance. If an athlete is able to use a high amount of oxygen, they're able to allow their muscles to work for longer and at a higher level, so therefore they're going to have a superior level of performance in an endurance event. VO2 max measurements are expressed in milliliters of oxygen per kilogram of body weight per minute, or ml/kg/min. Average VO2 max values are about 45 milliliters per kilogram per minute for 17-year-old boys and about 14 milliliters per kilogram per minute for girls. Training appreciably increases VO2 max, and an increase can be averaged from 15 to 20% on a 8 to 12 week training program. The highest recorded value for a female world-class endurance athlete is 75 milliliters per kilogram per minute, and the highest for a male athlete is 94 milliliters per kilogram per minute. And as you can see on the graph, elite male runners and female runners have a much higher VO2 max than the average male or female. Increases in VO2 max readings are accompanied by a remarkable jump in the number of oxidative enzymes. This causes the mitochondria numbers and size to increase. The mitochondria use the oxygen to produce energy, leading to higher VO2 max readings. Some increase in VO2 max is also due to increased blood volume as a result of the endurance training program. Lung capacity. No matter how effective the cardiovascular system is in supplying adequate blood to the tissues, endurance is hindered if the respiratory system does not supply enough oxygen to meet those demands. Oxygen is absorbed in the lungs where lung capacity is important. Total lung capacity is about 6,000 milliliters in males and slightly less in females due to their smaller size. In general, lung volumes and capacities change very little with training. Vital capacity, the amount of air that can be expelled after maximum inspiration, increases slightly. Residual volume, which is the amount of air that cannot be moved out of the lungs, shows a slight decrease. Overall, total lung capacity remains relatively unchanged. Following training, tidal volume, the amount of air breathed in and out during normal respiration, is unchanged at rest and submaximal exercise. However, it does appear to increase at maximal levels of exercise.